Oh, it's being recorded. Sorry, I forgot to tell you, because it is a public meeting.
Understood.
All right, board. Let's start with. I'm gonna call you out because of the way you are on my screen. So, Alejandro.
Yes. Oh, I went to unmute myself and I muted myself. Alejandro Prieto. This is my first year as an advisory board member.
Awesome, thank you, Caitlin.
Oh, everybody there still?
Yep.
Yeah,
Yes.
we can see you.
Yes. Hi,
Okay.
everyone. My name is Caitlin Abbott. I've been a member of the board. This is my 4th year. So looking forward to hearing about your program.
Great.
All right, Kim.
Hi, I'm Kim Strenga, and this is my 3rd year on the board.
Martha.
Hi, I'm Martha Wilson, and this is my 1st year on the board.
Great.
All right, Christina.
Hi, I'm Christina Pacheco. I'm the Director of Human Services, and I have been director since December, but I've been with the city since 1999.
Well,
Right.
congratulations.
Thank you.
And the person you can't see because she has camera issues is Brenda. She's been the one that handling all the scheduling.
Good to see you guys.
Hi. Wish we could say the same. Hi.
Sorry
Yeah,
about it. I tried. It was just a black screen again. So
That's fine.
no worries. All right, so we're gonna jump on into the Q&A time. I always allow the board to go first. Staff, of course, will jump in, but I always give the board the first go with questions. So, board, does any of you have any questions for True Care? Alejandro.
Yeah. Okay. So my question is, what are your efforts to diversify the organization's board?
Great. Thank you, Alejandro. And my name is Dave Sampson. I know that this is for the 5 minutes, and this is Carrie, my colleague and partner in crime here. So she'll introduce herself a little bit later. I'll primarily be answering, and Carrie will interject when she sees that I'm going off my path. So for our board, we have a 4 pronged process for our JEDI efforts, and one of those prongs lives at the leadership level on our board. We are working at the board level with our governance committee to have JEDI, so Justice, Equity, Diversity, and Inclusion, as a focal point for their conversations. We are currently going through a self-assessment to be able to identify a whole host of attributes, but inclusive of things that make us diverse. And as we look to fill positions at the board level, we are using that matrix to be able to help us guide and make decisions on how we identify people in communities where we are serving that could be more reflective of our patient population and our staffing population. So it lives on the board in the governance committee, and then in organization, it lives in a staff, in our employee board, in our strategic plan, and in our hiring efforts as well, and in our educational offerings for all of our staff and volunteers.
Thank you.
Thank you, Alejandro.
Go ahead, Caitlin.
Hi, David, Carrie, thank you both for being here tonight. I would love to hear from you, why, in your own words, I've read your application and seen it. I'd love to hear from you, why this program is important to the city of Longmont and to you.
I love the question. Thanks for keeping it open-ended. Our hospice and palliative care is important to all of us because we need to learn how to die better in America. And to have a healthy community means to have a whole bunch of healthy things like a library and healthy schools and good health care. Part of that is having an organization that helps our individual citizens make choices and learn how to die well, to acknowledge that that is a reality, and to be able to do it, and hopefully, if to do it in their own homes, which is where most people would choose to be at the end of their life. And so that's why it's important for the community. It elevates us as a community to be able to acknowledge and to support one another. And individually, for those of us left behind after the loss of a loved one, a healthy death and a good death provides the way and paves the way for good grieving, which I think ultimately uplifts and enhances our mental health and our mental well-being as well, to be able to cope with that loss and then to all future losses as well. And Carrie, I'll let you answer that too, since she asked it to both of us.
I would just add that it speaks to me because of my own personal experience with both of my parents. And what I learned through the process was, number one, the frontline workers in a hospice community are really special people and doing really important work. And so it's important for Longmont, and I echo Dave, it's important for everyone. But one of the takeaways for me was, gosh, I really wish I knew about it sooner. I wish I had gotten my parents on the service sooner, because it was available, but I just didn't know enough about it. So I think the more communities we're involved in, and the more we're sharing our work with our different cities in Boulder County, hopefully more people will learn that this is available to them, and make a really very devastating, difficult time just a little bit less burdensome. And also, thank you for all being here for us tonight.
We're grateful.
So a couple of things real quick, board. I don't mind if I don't know if you mind me jumping in, asking a few questions, and just give a quick time update. We have about 3 more minutes for questions, and then we're going to go to give them their time. I got to be a strict timekeeper because there's already folks in the waiting room. And I just have 2 questions. And I'll give real quick context. So the board looks really at the program and how it aligns with what Longmont's trying to do, where the staff's focus when we're evaluating your applications are look at different. So for example, we look at your agency budget and your program budget. We kind of look at your business model, and I have 2 questions based on that. One is, it looks like you are working with a deficit in 2024. Sounds like you had a deficit in 2023. You have decent reserves, 7 point some million. But, as we all know, that's not necessarily, when you have a deficit of $1 million every year, that's not a good place to be. Really quickly, what are your thoughts on that?
Mm-hmm. Okay, really quickly. Yeah, the choice to go into 2024 in a deficit situation is really a credit to our board and our leadership, recognizing the very unusual time that we're in now as a healthcare organization. So in terms of nursing care and CNAs in particular, it's a big part of who we are and a big part of our budget. And we have a strategic plan that helps us get through this so that we are able to recruit and retain our employees in a very tumultuous time. And so the investment into our strategic plan is that we need to invest our way out of this problem. We do not desire, nor do we put a budget together with a loss. We're usually in a 2 to 3% margin on the plus side. So this is definitely an oddity. Last year, we were just literally socked by traveling nurses and the transplant of the nursing and CNA field that are literally going other places, and then us needing to bring in travelers to make up for that at almost a cost of 2 to 1.
All right, and then last question. This is the first, or since I've been working here for 5 years, this is the first time you've applied. Why did you decide to apply, and why 103,000?
Boy, we asked that same question. Carrie and I are both relatively new. I've been here a year and a half, and I don't know if it was because our application to Boulder County in general, perhaps the thought was that it was inclusive of the Longmont community. I'm not quite sure looking backwards. But $103,000 is, we looked at all of Boulder County, including Longmont, and broke out our service population by the numbers. And so the total request was for 215. 103 is what we project that will be uncompensated for the citizens of Longmont. And that's inclusive of our care center, which is housed at the Longmont United at the hospital.
Okay, so you're asking Longmont to cover your uncompensated costs.
That is correct.
Okay. So I'll give you guys about 5 minutes, maybe 4, or we'll see. We'll try and give you 5, but we are just to make sure that we are on time. And I will email Jen saying we're running a little late. Go ahead and take your time to talk to us about whatever you want to share.
Great. Good.
Well,
So
can I just
go ahead,
interject one thing? We're not asking Longmont to cover all of our uncompensated costs because that is more in the line of $600,000. We're just asking for what we gathered from data in Longmont residents only.
Okay.
correct. Yes, I'm sorry if I was not clear on that. So our talking points are relatively straightforward. On any given day for hospice, we're serving about 288 patients and their families every day. We provide care for them to be at home wherever they choose to be. Most of us, it's in our own homes. For some people, a home is a long-term care facility or a nursing home or a retirement community. We also serve people who are unhoused, which is a different whole set of talking points, but that's our reality these days as well. Our median length of stay is about 14 days. That means half of the patients that we say hello to, we say goodbye to fewer than 14 days. Of that number, 31% of them are less than 7 days, fewer than 7 days. So in hospice, just to give you some context, the beginning of care, so when we bring a patient and their family onto our service, and the end days, the end 2 or 3 or 4 days are the most expensive. And it makes sense because we're sending more nursing support or more staffing support. There's way more psychosocial intensity, medicine, durable medical equipment, and those types of things are costly. And so from a bottom line, it is expensive, but really we know that we could be doing so much more for families if we have them sooner. What we hear most is, I wish we would have known about you sooner. I wish we would have called you sooner. And so that is our effort to really try and elevate people's awareness and understanding and appreciation of what hospice can do for a family who are at the end stage of a terminal diagnosis. Carrie, do you have anything to add to that?
Maybe just point out that we'll be marching down your main street with the Veterans Day Parade. We have a big float going, and we're excited because we work with We Honor Veterans program. We're a level 5 partner of We Honor Veterans, and we really care about the veterans. We've partnered with the project where they're building the homes in Longmont, and we're excited to spread the word about that partnership. So
Thank you.
We'll be in the parade.
11/11 at 11 o'clock. You can come. You could ride on our float. We have the biggest float in the parade. We have it's on a Saturday this year too, so we're hopeful that more families and kids will be out because it's not a school day.
All right, thank you. And I'm going to go ahead and end this hearing because we got folks in the waiting room. Thank you so much for coming tonight and telling us about what you do and answering our questions. If the board has other questions, usually they'll email me and I will get them to you, and then I will respond to the board. Does that sound okay?
That sounds like a good plan. And we are grateful for your time, and we're grateful for us being the first of what looks like to be a long evening for you. So thanks for sticking with it.
All right, appreciate you all. Thank you. Have a good night.
Bye. Bye.
So give us a second, Brenda, before you let them in. Just want to check in with the board. This is kind of, it is fast paced. This is kind of how it goes. This is why we always recommend to have the questions like,
Damn.
yes, exactly,
It's
written up
really,
before.
really quick, right?
Yeah, it does go by fast. 15 minutes is just, and yeah, so just be aware that that's part of it. And again, if you read the application and you have further questions,
Yeah.
email me. I will email them and I will get an answer to the whole
Okay.
board based on your questions, even though you're the one scoring it. Okay.
Really quickly, my camera for whatever reason does not work well in these Zoom meetings, so I'm going to be going in and out. I'm not
Just
intending
go
to
ahead and
be
turn it
rude.
off.
Okay.
Yeah, no, just go ahead and turn it off. It's fine. It's fine.
I second Kim. That's happening to me too.
If it goes off, just to keep it off, it's fine. And we'll just let folks know. And I already emailed Jen that we're running a little late. So you can go ahead and let Jen and whoever she's with in, Brenda.
It is just Jen this evening.
It is just Jen. Okay. All right. That's fine.
So all we need.
That's fine. Hey, Jen. Welcome. Sorry, we always run a little over on these meetings because they go fast. So I'm just gonna go through a quick breakdown and we're gonna let the board just introduce themselves. Just so you know, this is a public meeting, so it's being recorded. So you can see it on YouTube later on. You will have 10 minutes of Q&A from our board. And then you will have about 5 minutes to share whatever you want to share. You don't have to take up all those 5 minutes, but you have them. We'll try and honor that. I'm just going to go ahead and start with our introductions, and I'll let you introduce yourself right before we start questions. So I'm going to start on my right. Sorry, you guys can't see my screen, but that's where I'm going to start. Martha.
Hi there, Martha Wilson. This is my first year on the board reviewing.
Kim.
Hi, I'm Kim Strenga, and this is my 3rd year on the board.
And some of our folks are having camera issues, so they might go in and out, just so you know. It's not, nobody's wanting to be rude, it's just technical issues. Alejandro.
Alejandro Prieto, my first year on the board.
Caitlin.
Hey, Chad.
Hi, good evening, Jen. I'm Caitlin Abbott. This is my 4th year on the board.
And of course, Christina.
Hi, Jen. Christina Pacheco, Human Services Director. I've been in the position since December, but with the city since 1999.
And you can't see her, but Brenda is the one letting people in. So why don't you quickly introduce yourself and we'll start right away with the Q&A. Can you unmute yourself?
Oh, I thought you were talking to Brenda.
No, I was talking to you.
Okay, sorry. I'm Jen Jepson. I'm the executive director at Recovery Cafe Longmont. I've been there since July.
Awesome. So why don't we start with our Q&A? I always let the board go first. Alejandro.
First, I want to make a comment. Recovery Cafe is amazing. Thank you so much for your work. Thank you. My only question is, and I saw and read in the application that you're working on this. We need a little more diversity within the board. Looking forward to seeing the equity work pay off. So I've read that you're doing a lot of equity work. I've spoken to you about this even just earlier today. So where do you see the board in the near future when it comes to diversity within it?
Yeah, it's an interesting situation. We've got 3 of our founding board members that are still on. So we've been in existence. I think this is next year will be their 6th year. So we have bylaws in place for that reason. And so 3 of those folks will be transitioning off. So we're at a really interesting point in time with the agency. We just transitioned EDs and we're looking for a new space. And then we're also looking to figure out how to diversify our board. So with these three people going off, some of our efforts are really around who are some of these new people that we can bring on to soon, so we can ease that transition, but also move in the direction of a bit more of a diverse board. I think we do need to do some systemic shifts, as most agencies do, I think, because, like, for instance, our board meetings are on Wednesday mornings at 8:30. So if you want to have working people or people who aren't retired, we have to do some big shifts like that. So we are doing a DEI push for 2024. So that is both for staff and board. So that will hopefully also move into those directions. But I do want to say we do have 2 board members with lived experience in recovery. So one of our board members used to be a member of the cafe. So that has been a wonderful shift for us. And then another one was a volunteer, but someone who works in the recovery space. So that's been a neat gift for us as well. So hopefully that answers your question, Alejandro.
Caitlin.
Hi, Jen.
Hi.
I noticed along those lines, just having seen some of your previous applications, that there's been some big changes in the population that you serve. From that perspective, much closer to representing the city of Longmont than it did even 2 years ago, significant from when Recovery Cafe started. I am curious what you see as like the biggest challenge right now across all of the population that you serve. What the biggest challenge is for Recovery Cafe?
It's a good question. Aside from our space, which I don't think that's the question you're asking. You know, one of the biggest challenges that we're working on, we have what's a bilingual bicultural program, which is in our application. But I'm trying to figure out what that means, other than having 2 people who also speak Spanish. So I currently have one of our, Maria, who's one of our bilingual bicultural Spanish speaking peer support specialists. I've tasked her with what does a program look like? So she's currently got this whole like thing she's working on, this whole outline of how do we have a program? How do we move in the direction of having a Spanish speaking circle in the cafe? We have one that we partner with over at LCTC at the Halfway House, but having one in the cafe, and then having maybe some hours that are just dedicated to our Spanish speaking population. So we're trying to shift in that direction. And as you know, in the nonprofit world, it's like you can have these long-term goals and then the day is filled with lists things to get done. So thankfully Maria is taking it very seriously and Christina is supporting her in that, and we're all working closely together as a team to navigate that. So I would say that's our biggest challenge along those lines, is really figuring out what that means and how to center our Spanish speaking folks. But yeah, we've had some really great success in getting those numbers up, and it's delightful, and it means a lot to all of us.
Just give a 5-minute warning on questions, and then I have a question if the board doesn't mind. So, Jen, I always preface this real quickly that the board is looking at your program and they're evaluating your program and your program part of the application. Whereas staff, our job is to look at your business model and look at your, some of the things that you're working on, like your strategic goals. And I love your strategic goals, and I have this question of a lot of all of our agencies. You're not the only one I asked this question. This is a question I've asked a lot these last 5 years. Is I see a lot of programmatic stuff. And would love to know if you all, besides the capital campaign, what other, not program level, but agency level strategic goals do you have, or is your board considering?
Oh, that's a great question. I started in July, and I think the first thing I told my board president in June was, I need a strategic plan. So thankfully in November, we have a full day retreat. And that is at the top of our list, is to get a strategic plan in place, because we are more than just, you're right, we're more than just a capital campaign and we're more than just programs. So, yeah, like we've become very invested in the local court, in the local county court. And so we're partnering with probation. We're partnering with the integrated treatment courts. And so that's been a really big push. We're partnered with Boulder County Public Health with the Works program. So we've got outreach plans and outreach happening there. So our goal is, go ahead.
Okay, so to think about there is there any fee for service type of model that you could strategically think about as you're supporting these partners, right? So I mean, it's great that you can do it, but if they can support you, that would be awesome. So if I was on your board, those are the kind of questions that I would be asking, right? Is if we're going to be providing these services for these partners, is there any cost sharing type of work? So we got about 1 minute left. If any other board member has a question for Jen, and then we'll turn it over to her.
I
Christina
was impressed.
Go ahead, Martha.
But my question was just around, are you partnering with the local schools that have counseling programs? Just because I feel like I had to travel all the way to Greeley to get my counseling hours, and I live right here in Longmont, and it would have been nice to like pop into the cafe and work with some people in recovery. But that's just another avenue to consider for like internships, so that shortfall won't be so big.
Yeah, it's interesting because I just finished my MSW, so I had to do the internship hours, 900 of them. And I've been trying to figure out how an intern, with what we have right now, how an intern would get enough hours with what we have. However, partnering with the Reentry Initiative, which is upstairs, and they have licensed social workers up there. I'm not licensed. And so working in that partnership, and so that's really, and yeah, they're 2 floors above us. So that would provide a natural opportunity, because we can get supervision through them, because I'm not 2 years out of my MSW. So there's stuff like that that's working. But yeah, as far as the schools are concerned, we are we haven't really moved into that direction, just to be honest. I was like, there's a little affiliation, but not much, not enough yet to report on.
So we went a little bit over, so I'm going to give you about 3 minutes to do, if you have anything else you want to say, which is, yeah.
Oh,
sorry about that.
I am very grateful for this opportunity. Thank you for taking your time to listen to me talk, and thank you for your questions. And I really appreciate your thoughtfulness in considering our application. I adore the partnership that we have with the city of Longmont as well as the county of Boulder. And I believe that Recovery Cafe is really hitting that spot where people just need a place to belong. You know, they work so hard, and we hear so much, especially from our partners in the criminal justice system, where so many of these folks, they lose everything. They lose so many of their family contacts. They lose so many of their friends because they have to rebuild their lives. And so to be able to be part of that, to be able to be part of that piece where our peer support specialists just can meet people where they are and recognize their humanity, connect them with each other, and then also bringing in other folks from the community to break it down so it's not just us and them, it's we. So I'm really hoping we can move in that direction, especially as we consider our new space and all of that. So I love the work. I think it's a beautiful spot, and grateful for all the partnerships that we have.
All right, thank you. Thank you very much. Thank you for coming here tonight and sharing, and hope you have a great rest of your night.
Yes, thank you. That was zippy. You guys are
Yes,
very efficient.
They do go fast.
Eric's not even done with dinner yet, so
There you go.
all right, have fun. I'm done now.
Yes, you are
Okay.
done. Thank you.
Thanks, everyone. Good to meet you.
We're not doing too bad. We're about 5 minutes behind, I think. So it's not too bad. Sometimes we've gone further behind. All right, our next group is MHP. If you want to let them in, Brenda. All right, Jen, Katie, and Sarah. Hi, welcome. As usual, as you know, you've done this before. You will have 10 minutes of Q&A and then hopefully another 5 minutes for you to share whatever you want to share. I'm going to quickly introduce our board, let them introduce themselves. And then we'll let, as soon as right before we start the Q&A, I'll let you all introduce yourselves as quickly, as briefly as possible to make sure we have as much time for the questions. And I'm going to go from my left to right. So I'm going to go with Alejandro first today, right now.
Alejandro Prieto, first year with the board.
Kim?
Hi, I'm Kim Strenga. This is my 3rd year with the board, and I apologize, my computer's not working. That's why my picture's not up.
That's fine. Martha?
Martha Wilson. This is my first year on the board.
Caitlin?
Hi, Caitlin Abbott. This is my 4th year on the board.
All right, Christina?
Christina Pacheco, Human Services Director, and I've been in this role since December.
Awesome. As a reminder, this is a public hearing, so it is being recorded, but I'll turn it over to Jen, Sarah, and Katie to quickly introduce yourselves, then I'll turn it over to the board for questions.
Great. Hi, everybody. I'm Jen Leos. I'm one of the co-CEOs for Mental Health Partners. Katie?
Hi, I'm Katie Maffett, and I'm one of the clinical directors at Mental Health Partners, specifically overseeing Longmont. Sarah?
Hi, everybody. I'm Sarah Reed, and I do grant writing and grant management for MHP.
Awesome. So I forgot to introduce Brenda. She is, you can't see her, but she is the HSSB public. She's running everything behind the scenes. Alejandro, we'll start with you. You have the first question.
There we go. All right. So I do have a quick diversity question for the board, of your board, the lack of diversity from my point of view. But more importantly, is this question on outreach. How are you reaching the unhoused population? What are your outreach practices?
Great. Yeah. So Sarah and Katie jump in for sure. So we have a housing team that we have at Mental Health Partners. We do a large support for voucher support. We do support of, case management, and there's lots of outreach and engagement that occurs on those, on that team. Specifically for that population. I think additionally, when individuals come in for services, no matter where that is throughout the org, but in Longmont, if through our clinical assessments, we identify some of the social determinant of health needs and priorities that they may have through that assessment, and then we work on outreach and engagement to support those needs there. So Sarah, I don't know if you want to speak to anything to some of the grants that we have and just how we've incorporated that.
Yeah, I'll add briefly. So our housing team manages almost 500 vouchers, I think we're almost up to, throughout Boulder County. I think some in Broomfield as well, but it's predominantly Boulder County. And we have that program is funded by a host of other grants. So not specifically with our funding with this contract, but we have a pretty solid partnership, and our team is a member with the Homeless Solutions for Boulder County. And so we do a lot of that work, including some specific outreach in the community. So it's not all office-based, basically, out in the community, working with people who aren't housed to help with engagement and outreach awareness that services are available, those types of activities. And then lots of housing coordination and support that happens in addition and outside of the housing team specifically. So this contract that has historically supported the behavioral health home programs. And I think Katie can probably talk for hours more about how the behavioral health homes work to identify need, connect folks when there's something more that needs more specialized housing specific case management, and how the behavioral health home teams work with the housing team specifically.
Yeah, we work with a lot of complex cases, and so some of our biggest work this past year has really been to keep some of our folks housed and in some of the housing units that we have in and around Longmont, keep them on their vouchers, and then we are hiring for what we're hoping to be a complex care coordinator on our adult team that could be doing some community outreach and meet clients in the environments that they're the most struggling, because we know barriers to transportation are huge. So that is our hope once we get that position hired.
Anybody else has a question from the board? Caitlin and Christina.
Yeah, I have a very quick comment. Sarah, I think you were part of the group that was here last year. I did notice that there were some demographics that previously weren't tracked that are now being tracked. I saw the note that, for example, you track race and ethnicity differently and separately, and we were provided that information for the population served. So really appreciate that. That is something that can be difficult to pull. And I know in the past it was something that wasn't able to be provided. And so I just wanted to note that really appreciate that you all were able to pull that information so we can get a more holistic view of the folks you're serving.
Definitely appreciate that, and happy to talk more about. I know the data now it's presented in the proposal can be a little wonky. So if you have any other questions, please do let me know.
Christina.
Thank you. I appreciate, the data, the increased or the expanded data sets. That's always helpful. And thank you, Katie, for kind of framing out the vision for the complex care coordination and kind of where you're headed with that. What I read in the application was in part 45 days of kind of wait time once the assessment happens, and in one of your outcomes, and I'm wondering a little bit about that. And so what we know is that that some of the clients that specifically the Mental Health Partners works with can be pretty tough to work with. And so given that it could take up to 6 weeks to engage with them after assessment, really kind of what are the plans to make sure that things don't escalate for those clients in that time? Because I think that sometimes that can happen. And just wondered if you had any thoughts about that, or just any thoughts in general about how you might tackle that.
Definitely. So I know Katie for sure and Jen will have more to add about clinically how we handle that. The one biggest point of clarification I just want to share is that that's one of our common access metrics. That's not saying that clients don't get services until 45 days. It is an outcome metric, or really a process metric that we look at to say, we strive for all clients to get at least one service within those first 45 days after assessment. We are also now actually tracking up to 4 services within those 45 days as a more effective, just a little better storytelling of access into care. But at the time we were writing the proposal, we were looking at least one service within 45 days after. That's an access metric that we track at the state level. And so wanted to share that as well here.
Got it.
Say the 45, nothing until 45 days. That's our benchmark.
Okay. Does
that make sense?
So it doesn't mean
it can read funny.
And then 45 days. Okay.
No.
All right.
Yeah, we strive to really offer, services as soon as possible. That may not be individual therapy with a licensed clinician, but that could be health and
Right.
wellness groups, that could be
That
peer
makes sense.
support.
Yeah.
And hopefully, with this complex care coordinator, offering that intensive case management, because oftentimes it's not just the one contact, but they need several contacts a week, and being able to have that flexibility and time for that person to be able to do that for that individual, and whether that's at the library, their apartment, or wherever is most convenient. We want to try to break down those barriers for folks.
Got it. But there's some sort of touch before that 45 days. Okay, that's all the clarification.
Yeah.
Okay. Perfect.
And I'm gonna stop us there. I gotta be the timekeeper, and I want to keep us only 5 minutes behind. So I'll give you guys 5 minutes now to take your 5 minutes to tell us anything that you want to tell us.
Yeah, you bet. I think a few things that were highlighted for sure in the application. I think a big piece of what we've been trying to look at is really number one, and Alejandro, you spoke to some of this around the board piece, and it's around our Jedi work. And we are in the midst of a completion of an equity audit that we've been consulting with Groundswell Change for. And really our approach in looking at, from a complete systems perspective, what changes we need to make in order to support a more inclusive work environment for our employees, but then also for clients. We know we're missing populations. We know that there are clear parts of our community that don't feel necessarily comfortable coming to MHP and how we best serve. And so with that equity audit, they're really looking at workflows. I mean, really have read every document we have: workflows, policies, procedures, hiring practices, recruitment practices, board, and so that reading has been completed, and then they did over 200 interviews with staff from our organization. They're putting together those recommendations. We're starting to get those readouts of what that looks like. And then next steps to that would be, we're going to be engaging in 3 what they call solution labs, where we engage in actually action and change, prioritized based on a scoring system they did in what they found. And so really, I think for us, why we're excited, this is a really hard process. It's really having us be, really in a place where we need to be vulnerable and open to changes we need to make. And I think we're ready for it. And we're excited because I think this is going to affect how we better serve our clients and our community. And so, Alejandro, that does affect then board too, right? And how we look at board recruitment and support to the board. We have advisory groups right now that also support board and feedback. We have an employee advisory council. So there's different things that we'll be continuing to look at to influence that. So I think that's a big piece of what we're looking at. I know that was also outlined that our team-based and client-based care is still the crux of what we try to strive to provide and do, just not around access, but best care. I think, with our behavioral health home, which this grant really supports, that allows us to support access and right service at right time, and getting people to the right spot. There's also some additional services that we, through other grants, have been able to incorporate, and that we're starting this year, that I think are going to be important for Longmont community, based on what we've seen from the behavioral health roadmap and sort of needs within the community, specifically psychiatric urgent care services and then intensive family services. So those are 2 things that, we're adding in addition to some of what we've been providing at MHP. Katie and Sarah, what did I miss? Because I know we have 2 minutes.
I think you did a fantastic job. I am definitely partial to our health homes. I think they do a lot of great work. Our staff really strive to provide the best care. A couple of success stories that we've had this past year is in collaboration with other community partners in Longmont. We've been able to get 2 of our clients' vehicles so that they can get to work or maintain their job or employment, get their kids to school, maintain their kids in their home. And one of those cases was at that initial registration appointment. They identified that need and were able to coordinate and get that individual that resource. And so that's a huge thing. I think they are dedicated to helping our clients. And they do wonderful work. Right now we're working, we have about almost close to 2,000 that we have between our adult and our child and family health homes that we're serving.
All right, thank you. I think I'm going to stop us there to make sure that we stay the 5 minute behind instead of going to 6. Really appreciate Katie, Jen, and Sarah, your time tonight, and hope we have a great rest of your night.
Thank you all so much. We really appreciate your support.
Yeah. Thank
you.
everybody.
Thanks for having
Good
us.
night.
Take care.
So before we let the next group in, we do have a built-in break, and we actually have a longer break because what the agency that was scheduled had to reschedule because they just lost their ED. And so when that happens, just so you all know, we tell the agency, yes, you can reschedule. If they miss it, we wouldn't even consider it. But if they can find it another time with another agency, then that they can switch or whatever, then that's fine too. So they have to do the work to reschedule with us, not us with them. So they're not going to be here, so we're going to have a little bit extra break. So why don't we let the last group before our break is Centro Amistad. So go ahead and let them in, Brenda.
Sorry. Oh, Eliberto, which group was?
Dental aid. They had to reschedule.
Who was it? Oh.
Dental aid. So, all right. Jorge, welcome. If you can turn your camera on, that'd be great. Understand if you can't, if you have some issues. I'm doing Jorge. We're gonna just a couple of quick reminders. This is a public hearing, so it is being recorded, and will be available on YouTube actually at some point. We're going to go really quickly and introduce, as usual, you get 10 minutes. So I'm going to try and introduce the board real quickly to give you your time for question and answers. And then you'll get 5 minutes at the end to share whatever you want to share about your program and or organization. All right. So let me introduce the board. I'll start on my right this time. I'm mixing it up. Martha.
Martha Wilson. This is my first year on the board.
Caitlin.
I'm Caitlin Abbott. This is my 4th year on the board.
Kim.
Hi, I'm Kim Strenga. This is my 3rd year on the board, and I apologize, my camera is not working. That's why I'm not on the screen.
Alejandro.
Alejandro Prieto, 1st year on the board. Buenas noches.
Christina.
I am Christina Pacheco. I am the Director of Human Services, and I've been in this role since December, but with the city since 1999. So welcome.
And you can't see her either, but she is the magician that makes all this work. Brenda's in the background there. So I'm gonna turn on my timers. I'm gonna get smart. I'm gonna get a timer, and I'm gonna go ahead and start. All right. Who has the first question for El Centro Amistad? Alejandro.
Yeah. Thank you, Jorge. I read through the application, and I'm just curious on how do you reach the LGBTQ plus community within the Latinx, Hispanic in our communities, because I know it's hard culturally. It's something that we're all adapting and we're all accepting and evolving into.
Yeah, absolutely. I think one of the things that primarily, we do collaborate very closely on those education access to the Latino community with Boulder County. So we have been collaborating for a while, really providing education to parents specifically, but we have a really big connection with Boulder Valley School District, with the middle school and the high school students. We have programming there, and intentionally we have been adding the discussion and addressing that issue of LGBTQ as an inclusivity issue in our community, for a while. So, to answer the question more directly, we have been hosting, for parents, educational kind of Q&A sessions regarding to that. And we have a specific programming for parents that is Escuela de Padres y Madres, that we talk more specifically, but that's more related to an 8-week program. But we also add that identity piece to that conversation. Everything is a cultural-based, evidence-based program that we have as well.
I had
One comment I would like to say, I'm so sorry, Martha, just real quick. Just like something that helped me because I'm a father, transgender child, and as we know in our culture, it was crazy for me. But I learned love led, I accept it is my child, and I got a boy out of it. You know, he's a man for me. You know, I gained him.
That's
La canción El Gran Balón. When I heard it when I was a little kid, I said I can never be that dad that will deny his child because of a change, you know, of who that child is. And so it was impactful. I just had to say that comment real quick.
Oh, thank you. But it's also, one of the things that we really take as a point of conversation of, Latinos like you really having, able to really open up. We have a group of parents who having gone through the similar situations, similar experience like you. And we are very supporting organization, but they became really active within that community to really educate other parents. They have questions, they're always available. So thank you for mentioning, but yes, it's important to really support everybody because what I say, all those kids are our kids too. So.
Awesome. Martha, you had a question.
Yes, I was curious about your client count. I was reading about like your true generation approach. So is that client count per client in a household? Because for instance, you might be serving, like a 16-year-old girl, but you're working with the entire family system. So that might actually be 7 people, not just the one. So I was just curious if your client count actually reflects the true number of actual people you're help.
Yes, thank you for the question. Yes, we haven't really, one of the things that how we access the community, and we knock on the door just by visiting a mom. But once they enter the home, they see that they have a grandfather, a grandma over there, a couple aunts and everything. So the family gets bigger. So we do offer that kind of complete packet, the family they want. So we do, we ask them, we have program for the elders, we have program with the teens, we have program for this. So we count in once they participate. Technically a lot of the everything that we count, it can be one of the programs, it can be teens program. So we have the parents participating there only through that program. But when we do the household visitations and everything, and everybody's, we count everyone in the family. If they participate on the programs, we offer it to them for free.
Awesome. So Jorge, I do have a question, and I ask this every year. I ask this question a whole lot. So I was looking, of course, question number 1 in the application really asks for your strategic goals, and you have a lot of great, and I think I see this a lot more with our smaller nonprofits, a lot of great programmatic stuff. You talked about all the different wonderful things you're doing, but I was wondering, what kind of agency strategic goals do you have? Like, for example, how do you foresee El Centro continue to be sustainable into the future? I mean, as you grow these programs, I was looking at your agency budget, because that's part of the stuff that the staff looks at. The board looks at your program. I look at your agency level stuff, and I'll give you an example. One of the questions I had. I mean, I see that you do pretty well with foundations, of course, governments, but with donations and fundraising, that's still something that's still a little struggling. So just kind of wanted to check in with you about what are the board's thoughts? What's your thoughts on that strategic plan of becoming more sustainable?
Yeah, thank you for the question. I think that's something that we have been taking under consideration for a couple of years already. So we applied for a couple of grants, and we were lucky to get a capacity building support through the Colorado Health Foundation.
Oh, that's awesome.
Really,
good.
Yeah, that's for 3 years. It's a 3-year grant that we just started this year, and that's, I think, the number 1 strategic priority for the organization, to really increase the individual donor base that we don't have. We have some donors, individual donors, but it's only reflect for less than 25. They donate 5,000, 50,000. So yeah, we working with these consultants, with this group, through this grant, strategic planning grant, and to identify those priorities for the organization. And yes, the sustainability for the programming, not dependent and kind of balancing and increasing the percentage of donors. for Amistad, that's the number one priority. So we're working on that, and we expect to have, like a better idea of how we're going to be doing starting 2024. The reach, doing a lot of outreach technically, and developing those strategies to build that base, because now that we have that, the program, the results, we want the community to really be behind and support it, investing in new programs that will benefit the community. So
Thank you. So we have about 3 minutes left. Any other board member has a question? Or Christina? Well, if not, we will stop our time early and give you 5 minutes, Jorge, to do your thing. I'll stop the timer since we don't have any more questions.
Thank you. Well, thank you so much, for your support. I think, we so new to Longmont in terms of receiving funding. That I have seen the results right away in the first year. I just want to mention, now you probably already know, but we have 2 offices already in Longmont. We have a presence there. We've been building collaborations. We have hired one person that she has been working in our community for years to, she used to work for El Paso, Ere Juarez. She works with us now, so she is really helping us to build that community. My whole team has gone over there to really build and connect with the new communities in Longmont. And something that I was happy to see, that we have a lot of work to do in terms of really connecting, because people were like, wow, what do you guys have? It's not just about us, it's really connecting them with the resources in the whole county, but in the city. We collaborated also with CU and Public Health just to do some surveys, a couple months ago. And we visited, communities that were so isolated in terms of information and resources, that we say, man, this is the work that we like to do, go and provide that support to the community. And I think with the funding that we have been receiving, it has been really reflecting that, not just providing the programming and collaborating with other agencies in Longmont, but just going and visit and really get to know those communities, one-on-one. So we had a couple of, really like a small events in a couple of those communities just to get. But something that I'm happy to say, we just hosted a women's conference. And this year, we have 65% of women participating that were from Longmont, man. So that really reflects, that connection that we already have, because they said, well, we didn't know about it, stuff like this. So again, yes, thank you for that support to Amistad, really providing that capacity over there. And for us, it's really excited to really move into new areas of support for the community. So that's all I wanted to say. Thank you.
All right. Well, thank you so much, Jorge, for being here tonight. We appreciate your time. So we'll let you go. And have a great rest of your night.
Thank you. Have a good night, everyone. Nice to meet you. Bye.
Bye. All right. So because that agency, so a couple of things, because that agency couldn't go tonight, we had already, the board had asked for us to plan in a break, so it wouldn't be straight hearings. And so we have a scheduled break that would have gone after the next agency. So we are not scheduled to start again until 7. So you have about a 30-minute break between the next one. So I would just say, turn off your cameras. Brenda, I don't know enough about Zoom. Do we still keep recording? Do we start recording? What? I don't know about that. How does that work? Because I don't want to. You can pause it. Okay, we can pause it. All right, then we are officially on break until 7 o'clock. Try and be here a couple minutes before and go get us back on time. We were only 5 minutes behind, so I'm pretty proud of that. Thank you all. Hello, Elia. We're hoping that we'll make sure you get connected to the sound. Good evening. Thank you for joining us. Can you hear us?
I can. Thank you.
Okay. Awesome. I'm gonna do some quick housekeeping, quick introductions, and then we're gonna get started to make sure that we stay on time as much as possible. It's not always possible. So just so you know, this is a public hearing, so it is being recorded and will be on YouTube at some point. You will have 10 minutes of Q&A from the board, who will introduce in a second. And then we'll give you 5 minutes to share. You don't have to take all those 5 minutes, and we don't have to take all the 10 minutes either. That always happens. And then we're going to go ahead and introduce the board and staff who's here. And then right before we start the questions, I'll give you a chance to introduce yourself. Okay? All right. So I'm going to start with Kim in the middle. We'll do like Hollywood Squares. Kim, can you introduce? I wonder if she's having technical issues. Well, okay. We'll see if Kim can join us here in a second. Martha.
Martha Wilson, this is my first year in the board.
Awesome. Caitlin.
Hi, I'm Caitlin Abbott. This is my 4th year on the board.
Alejandro.
Alejandro Prieto, my first year.
Let's try Kim again. Kim, can you hear us? Or can you unmute yourself? So I'm not sure if Kim can hear us. Oh, there she is.
Oh, here I am. Sorry. I'm having technical difficulties. That's an understatement. I'm Kim Strenga, and this is my 3rd year on the board.
Awesome. I'm Eliberto Mendoza, Project Coordinator for Human Services. You can't see Brenda. She is the person who schedules all this and works behind the scenes to make sure that we have these Zoom calls ready. And then I'll let Christina introduce herself. And you're on mute, Christina.
Oh.
There you are.
There we go. I was unmuted. Christina Pacheco, Human Services Director, City of Longmont.
All right, Elia, I'm going to go ahead and set a timer. Why don't you introduce while I'm doing that? Introduce yourself, and then we'll start with Q&A.
Perfect. Nice to meet you all, and thank you for this opportunity. My name is Elia Barraza. You see her, ella pronouns, and I am the Generations Program Manager.
All right, and I've started the timer. We have 10 minutes for questions. Any board member wants to go first? Kim, and then Alejandro. All right, here we go. Now we got they're rolling in.
Hi, I just had a question that's actually a common one this evening about increasing diversity on the board, both racial and gender as well, if there's any efforts being made in that area.
On the Board of Health?
The board of directors or the advisory board for your program, I guess that's.
I think you might be getting it confused with Genesis. So we are 2 separate programs. So there's Generations and then there's Genesis. And I know Genesis is initiating an advisory board. We do have a leadership cohort. So I don't know if that's.
It was part of the application to list your board members and representation of those board members. Eliberto, am I describing it correctly?
Yeah, you are.
The Board of Health, then maybe? Is that
it's probably your Board of Health.
Okay.
Okay.
Yeah, because you're mostly our the people who apply are nonprofits, so we rarely have governments apply.
Right. And yeah, Kim, I'm not aware of any strategies or ways that they're trying to diversify the board. I think we've had quite a few new board members, and I believe they serve several years on the board. And I don't know what that recruitment process looks like, unfortunately. So not too involved in a lot of that stuff, given it is a government agency. And so I think the Board of Health is trying to look at building better connections, honestly, with the staff, because they've kind of been a little bit disconnected with public health. And so they're looking at really trying to build those connections a little bit more. And given we have new director in filling that position, we're hoping to build those connections a little bit better. So learning a little bit more about how that works.
Great, thank you.
Alejandro.
You're on mute.
Yeah, the screen kind of warned me. I was like, "Hey, you're on mute, guy. You're talking. Nobody's listening." Well, because I'm not letting them listen. What are your outreach efforts? And please explain like a day-to-day operation of your outreach.
So just in this last year, we really increased our outreach efforts, only given because of obviously the pandemic. We lost a lot of connections with partner agencies, a lot of referring agencies, obviously disconnect with community as well. So we really increased our efforts this year to also increase referrals and caseloads. And so we reached out to a lot of community agencies, community partners, and offered a lot of informational meetings to provide presentations on the program and connect and reconnect with new agencies and partner agencies that we've worked with in the past to increase our enrollments. And so I would say we've done a really good job this year with that, and we're hoping to continue that next year. We've had several of the same agencies call us back to come present to them again. I think there's quite a few groups through Boulder Valley School District that have requested presentations again now with the start of the school year to increase enrollments, youth enrollments and families. Did that answer your question, Alejandro?
All right. Anybody, any other board member? Awesome. Anyone else has a question?
So is
Martha?
it?
Go ahead. Sorry.
I'm sorry if this is like such a to the point question, but like I was trying to read between the lines of what it actually is. It's sex education.
So we're a youth and parent guardian mentorship program serving youth ages 12 to 20. So the youth is the primary client, although we do have a two-generation approach. So we serve the parent and guardian, parent or guardians as well. So we have youth specialists that do case management services, and they're the ones that do the one-on-one services. We have a parent specialist that provides the direct service to the parents. And then we have a group facilitator who facilitates our groups, which include pro-social groups, community service learning projects, and our Generations Leaders organizing cohort. And a component of the services does include sexual and reproductive health education. And so, yeah, and then we do focus, on ensuring school success and pregnancy prevention or unintended pregnancy prevention.
Okay, so that's not like the full focus. It's one of many items.
Right, comprehensive, holistic approach to services, a wide variety of services, education, connecting to resources. Yeah, a lot of different things.
Okay, thank you.
I'm wondering, I got another question, if possible. Do I have time, Ellie?
Yeah. We got about 4 minutes left.
Okay, cool. So I'm wondering for outreach purposes, because there is an uptick on young women and young men out in the street that are unhoused, right? Lacking that support from family, from parents. So I'm wondering if there's any way for outreach purposes you can perhaps partner up with Rewind, Lead, other programs that are out here that the city already provides, and it'll provide you that platform that you can bridge and reach those populations. Just suggestion. It's more of a suggestion than a question. I'm sorry.
No, that's okay. And I appreciate that suggestion, actually. We've seen a couple of refugee referrals and immigrant youth. We just recently had one youth decline services. But yeah, just either through self-referral, we're getting some of these referrals as well, with youth connecting to other youth at school and, needing some of those services. But thank you for that suggestion. It's certainly something that I'll definitely look into.
I have a quick question, if that's okay. One of the things I noted in your application was, there's a really strong link between mental health and risky behaviors. And I'm curious if you, as this program has evolved, right? It evolved out of an existing program that was really focused on unintended pregnancies, and is more of like the wraparound with the 2-generational approach. Is that hopefully I'm encapsulating it correctly, but what have you seen any specific changes in terms of like the needs around mental health recently? I think it's something we're hearing through a lot of our agencies, but I'm curious what you're seeing with the populations that you're serving.
Yeah, we have seen a significant need with services and supports. Obviously with the pandemic, losing a lot of those social connections, our youth have really been impacted. It's really been hard to build relationships, and not only with trusted adults, but also among youth, and getting them to join us for some of our groups. We've really been trying to increase, offering, whether it's like dinner or incentives for them to attend. But we have seen, I think, a lot more youth experiencing anxiety, depression, expressing needs for therapeutic services, and we act as a bridge, trying to connect them to some of those services. Obviously, working with parents and guardians as well. Both parents and guardians and youth, the whole family oftentimes needs some of those services, whether it's individually or as a family. And so we certainly try to connect them to resources.
All right, Christina, probably the last question, because we probably have about a minute left.
Okay, thank you. Thank you. So part of what we look at as a team that reviews application is staff really looks at the financial piece of your application. And in your application, it looks like $281,395 of your budget, of your projected budget, comes from Boulder County government. Is that public health funding?
Not all public health. We actually don't get, we don't get a lot of county funding. Public health, we have very few grants. And then we don't get a lot of county funding. We often rely on a lot of applying for grants, although we don't have like a grant writer, so that often falls on program managers. But yeah, a lot of it does fall back onto public health and just general funding that they're able to supplement. So
okay, and is that different from other programs that are funded in public health? Are there other programs that are, and do you know why?
Yeah, from my understanding, and I'm not too savvy on the budgets, but like environmental health, that often deals with like emergency things, or like immunization programs, obviously, get some of that funding that trickles down to those programs, and don't necessarily have to rely on grants. Because we are in the community health division, we do often need to look for funding for some of our programs, which are more community-based serving and direct service to the community.
All right. Thank
All right,
you.
so we'll give you and again, you don't have to use them, but all the 5 minutes, but we'll give you your 5 minutes to share anything you need to share.
Yeah, well, thank you for this opportunity. I know, like, historically, City of Longmont, I think we've received funding in the past several years back. I was trying to look back at some of the grants, and I didn't see too much in there as far as, and I just came on in my position less than a couple of years ago. And so, thank you for the opportunity. We are a program that has been around for many, many years, and we're well connected with many partners and community agencies. And hopefully you will consider this grant proposal. This grant proposal is really to fund a position to increase hours for what used to be called our sexual and reproductive health specialist, but that really focused on a lot of policy and advocacy work. And so we're hoping to increase the hours for that position, because that was a part-time position. And given the climate now, political climate, and so many changes in that realm of sexual and reproductive health, we felt there is a greater need, not only for sexual and reproductive health, but health and wellness and mental health. It encompasses, everything is all related, and somehow connected. And so we're hoping to increase the hours for that position to also expand services and
Okay.
you know, connect with so many other community partners and provide those services.
Thank you for saying that, because that kind of gave me a real quick red flag, right? So this funding is for direct services, not policy and advocacy work per se. I mean, not that you can't do, but typically it's meant for direct services.
Okay. And so like if they were working on, if it didn't fully fund that position and some of the funding came from another resource, that would also cover the policy.
Yeah, that'd be
and
fine.
advocacy.
That'd be fine.
Okay.
Yeah.
Yeah.
Because typically this funding, it's human services funding is for program funding, right? So
Yeah.
that typically entails delivering services to our low and moderate income families and individuals in Longmont. So
Yeah. and
thank
this
you for
person would-
clarifying that
yeah,
that they do direct services.
they do. They would be providing some of those educational classes and connections and collaborations with partners. Yeah.
Okay. All right. Thank you. All right. And that is it for you tonight. Thank you for joining us.
Thank you. Have a good evening. Bye.
Right. So our next is another public health, but again, they want it to be separate. They're not, since they're, yeah, public health has multiple applications coming into us this year. And so our next one is Genesis, not Generations. And they're the ones I think are looking for that advisory board. So why don't you go ahead and let them in, Brenda? All right. Hello, Mary. I hope you can hear us.
I can hear you. How are you?
Awesome. Good, good. So let's do some housekeeping real quick and then we'll get started. This is a public hearing, so it is being recorded and will be available on YouTube. So what we typically do is we're going to have, it's 15 minutes, 10 minutes of Q&A from the board and or staff. And then we'll give you 5 minutes. You don't have to use them all if you want to share anything. Before we get started, I'm going to give the board a chance to do quick introductions, introduce staff, and then give you a chance to introduce yourself quickly, and then we'll start with questions. Okay? So let's start the other way around. Let's start with Alejandro first.
Alejandro Prieto, first year as a board member.
All right. Kim?
Hi, Mary. I'm Kim Strenga. This is my 3rd year on the board.
All right. Martha?
Martha Wilson, this is my 1st year on the board.
Great. Caitlin?
Hi, I'm Caitlin Abbott. This is my 4th year on the board.
All right. Amelie Berto Mendoza, I'm project coordinator for human services. Christina? Oh. Might have hit the wrong button.
Christina Pacheco, Human Services Director, City of Longmont. Hi, Mary.
Hi.
And in the background, you can't see her, but she is the person who does all the magic, is Brenda Palacios. She's our executive admin, and she's the one that scheduled these. So really quickly, go ahead and introduce yourself, and then I'll start the timer for the questions.
Hi, I'm Mary Faltinsky, and I am the program manager for the Genesis program. We serve the entire county, and I've been in this position for 6 years.
All right, I'm going to go ahead and start it. Anybody have questions for Mary? Kim?
Yes, I love the Genesis program, and as I was looking through the application, I saw that there is some consideration in terms of outreach to fathers, and I'm just wondering what kind of programs are in line for further development to support fathers.
Well, what we would really like to do, frankly, is hire a father staff member, which would require raising significantly more money. Because I think right now, we match families with a case manager with lived experience as a teen mother. And while these staff work with the whole family. So for example, we had a group last night at the Longmont Hub where we were painting pumpkins. We had 4 dads there with 25 moms. So we engage fathers somewhat, but I think to really recreate the experience that moms get out of our programs, we would need to hire men who had lived experience as being a young father. So that's something that we have a full proposal for. We've put it out for funding. We have not yet gotten funding, but that's what we would like to do.
Thank you.
So Mary, just really quickly, I have a question, and just so you know, the board is looking at your program, and their questions are going to be program based. I look at the agency, and actually, when you said that, something came up, and this is probably a bigger question than you, but I think it should be asked, and I think public health should consider it because there's multiple applications for public health in this year's round. What Boulder County HHS has done is they've created they've created a separate nonprofit to apply for funding, which I think makes it easier to apply for funding. You all don't have that. If you do get funding, it's going to have to be an IGA. Is there any thoughts to actually just creating yourself a 501c3 to make it easier to apply for all sorts of different types of funding?
Well, I think one of the interesting things about Boulder County Public Health is it's actually a separate entity from the Boulder County government. It has a separate Board of Health. So it's already somewhat a legally different entity. So I almost think it's unlikely that within our agency, we would create a separate arm, because I think part of the reason we are a separate entity is because Boulder County Public Health receives so many outside grants. We receive a lot. I think we receive more federal grants than other county agencies because of public health nature. So I think there's a slightly different configuration, but there, as far as I know, there's no conversation about creating a nonprofit within the local agency.
Okay. Alejandro. You did unmute yourself.
I clicked the wrong button. That explanation was really cool because I saw that the Boulder County Public Health just like recently changed their like .orgs to .gov. So I was wondering what was that all about. So that separation, that's pretty. Thank you for explaining that. I did notice that, and this might be a bit repetitive for my colleagues, but that your board is mainly comprised of white Caucasian women. And I was wondering if there's any plan to diversify that a little bit more, not only with racial lines, but also I see there's no non-binary people, and having a gay child myself, lesbian. She identifies as a lesbian, that had a pregnancy scare. She's a teenager. So, it does happen, especially younger individuals that are now, forming their identities and really exploring who they really are. And just wondering if there's any plan on diversifying your board.
I'm sure that that's a goal of the health department. I have to say that that's also pretty far above my pay grade. The Board of Health is appointed by the county commissioners. People apply. So I don't really know what efforts the agency does at recruitment and encouraging people to apply for that. So I don't have an answer for you. I do know that within Boulder County Public Health, we have an equity team. We do have representatives, certainly within the community health division, that are non-binary or trans. And we have more people of color in the community health division than in the health department as a whole. Our program, half of our staff are Hispanic, which is closer to a match to the clients we serve. So we certainly recognize that as an important goal, but I can't answer your question about what the health department as a whole is doing for the Board of Health.
And I totally understand. It was just like one of those.
Yeah,
maybe
well,
you had an answer.
You can't help
but
not. I
yeah.
mean, you got to notice it. It is surprising. Yeah.
Thank you.
We have about 3 minutes left. We don't have to use them if the board doesn't or staff doesn't have any more questions.
I have a question.
Go ahead.
Thanks for being here, Mary. I am curious, for this program, for the Genesis program, what do you see as sort of, I guess, what is the thing that Genesis brings to this population that isn't being met by other services? Obviously, you're within public health. I see a ton in here about, partnerships with other organizations to provide things. And so where do you see Genesis providing something that like folks just really can't get somewhere else?
Well, I think one of the misperceptions is that there are a lot of services targeted for teen parents, or that there are no more teen parents in the county. So this is an extremely high risk group, and what Genesis has created is a great deal of expertise in working with people at this developmental stage, at understanding what older adolescent behavior is like and how that intersects with parenthood, and what challenges that creates. Because people think, oh, there's got to be housing for teen moms, but we recognize, like, you can't sign a lease if you're under 18, or you can't go into like the together tension homes if you have a kid. There's just all these little intricacies of serving this group, or maybe you have folks who their parent, you have to engage the parents. So say maybe a typical home visiting program isn't relating a great deal to the grandparents, and we recognize that that's really important if the teens are still living at home. Or we recognize that teens maybe don't have privacy because they don't have their own home, they're living at home, and so we'll meet with them elsewhere. We'll provide transportation, which almost no service will drive folks around, but we know our clients often don't have driver's license. We help them access services such as, there's now a teen driver's education program for teen parents. There are waivers of child support if you're applying for child care assistance for teen parents. So there's just a lot of intricacy that we've developed a great deal of expertise.
That's awesome. Thank you so much for providing that information. It's really helpful.
We got about a minute and a half left. Not sure, Martha, if you were going to ask a question.
I was just reading, one thing that stuck out to me was the Prevent Child Abuse America home visiting program, because I worked child protection there and knew nothing about it. So I was like, that would have been an amazing area to know about and be able to refer people to. I feel like I can do that now in the role I'm in now, but the question I had is with regard to like if there's a way to partner there, because I feel like some of the times that I went out, especially with families of color, like it could have been structured and wrapped around in a way that gave it more stability rather than kind of piling on to the stress of an already stressful situation.
Well, we see as one of our really explicit goals is to try to prevent child removal. And so if we shore up these families at risk, we think we will see less of it. And anecdotally, like, we don't have any children who are removed right now. Now, that's not the case. 6 years ago, we had many of our families we were working with, the children were placed in foster or kinship care. We are mandatory reporters, but if we report, we talk with our families about it. We do our best to get child protection staff to work with us in collaboration with us. We're currently working with the Impact Board to try, which works with really high risk families, but mostly they're looking at teens with mental health, substance abuse, and juvenile justice involvement. And we're trying to help them recognize that teen pregnancy is another way that high risk manifests, and to sort of think of teen families as needing those extra wraparound services as well. So it's really on our minds, and we're really trying to work collaboratively with HHS where we can.
So our 10 minutes is up. I'm going to give you your 5 minutes. You don't have to use them all, but I'm going to start the timer. If there's anything else you want to share.
I just want to say that I am incredibly proud of Genesis, and it's been around for 32 years, so I can't take credit for it. But some of the things that we have done recently, we have affiliated with the Healthy Families America. So now we are an evidence-based program, and that's been really crucial for us to be able to bring other resources into the county. So we're receiving more state funding. We're working on receiving Title IV prevention funding, which is to keep kids again out of the child welfare system. So it's a really highly skilled team. Most of our clients are in Longmont. So we serve families throughout the county, but we serve a lot of families in Longmont, and we know the city of Longmont really well, and we know the constellation of services. I don't know if you know that the New Meridian High School Teen Parenting Program is closing. The Child Care Center is closing. So one of the important resources that Longmont has counted on is going away. And so we are seeing that we need to help students access the ability to stay in school. In Longmont, we've recently had a lot of younger teen parents in the age of 14 and 15-year-old. So we're helping them navigate the school system. This is a change. I don't really know why we're seeing these younger teen pregnancies that we had not been seeing. But I think across the county and across the country, some use of birth control is falling a little bit among teenagers, and that probably explains it. The other thing we're seeing in Longmont is more immigration from Central America. So we do have 3 completely bilingual staff, and so we have been able to accept and serve every referral. So we feel like we're being very responsive to the needs in the city of Longmont.
Thank you so much, Mary. Appreciate you being here. And if the board has any questions, I will follow up.
Okay, thank you so much for your time.
All right, so we have our last group. This is way different. We're not getting done at 9 o'clock, Caitlin. We're getting done at 7:30 something, probably closer to 8, but still, it's an hour.
It feels far more manageable mentally, right?
Yeah, it's more nights, but we're
yes,
we're getting done a lot sooner. For those that hadn't done it, we've been here till 9:30, close to 10 at times. So
And I'm sure even longer when they were in person, right?
Oh yes, they were long.
I'm gonna be totally honest. I did this for every single one of the applications.
Awesome, great.
So I was expecting a 9 o'clock let go.
Yeah.
So I was pleasantly surprised.
Right. Yep.
All right.
I wrote notes for each and every one of mine too. So yep.
Yes, just remember to put stuff in the actual evaluations. That's what I do. I put most of my stuff in the evaluation. Just so if we don't fund somebody and they have questions, I can always go back and say, well, here's what we've heard.
Okay.
So just a quick reminder to do that. All right, our last group is another new group in Midwife Collective. Yes. So if you want to let them in, Brenda, and this is our last group for the night. All right. Hopefully you're good evening, Rachel and Stephanie. Hopefully you can hear us and see us. I want to welcome you tonight to our health and well-being hearings. Just a couple of housekeeping. This is a public meeting, and so it is being recorded and will be on YouTube for the City of Longmont YouTube page. You will have 10 minutes of Q&A from the board, and then you will have 5 minutes for you to share anything you want to share. You don't have to use the entire 5 minutes, and if the board doesn't have 10 minutes of question, they don't have to use that either, but we just assign 10 minutes for that. I'm going to quickly let the board introduce themselves, and then I'll introduce our staff, let you introduce yourself, and then we will start the Q&A time. So it seems like Stephanie's still trying to connect to audio.
She's got a kid in the tub, so I'm sure she might be in and out a little bit. So
okay, all right, okay. So why don't we start with Caitlin?
Hi, good evening. I'm Caitlin Abbott. This is my 4th year on the board. Welcome. Thanks for being here tonight.
Thank you.
Awesome. Martha.
Martha Wilson, this is my 1st year on the board.
Alejandro.
Alejandro Prieto, this is my 1st year on the board.
Kim.
Hi, I'm Kim Strenga, and this is my 3rd year on the board.
And I'm Eliberto. I am a project coordinator, and you don't see her, but Brenda is in the background. She's the one that schedules all these, and she's also the one who runs, does the background on the hearings. And then we have Christina.
Christina Pacheco, Human Services Director.
All right, I'll let you all introduce yourself real quickly, and then we're just gonna jump in, and I have a timer set for 10 minutes. Why don't you all introduce yourselves, and then we'll get straight into questions.
Great, thanks. I'm Rachel Engel, one of the midwives and co-founders of Community Roots. And yeah, that's that's about it.
Stephanie.
Hi, I'm Stephanie Minert. I'm fundraising coordinator, also do admin work for Community Roots Midwife Collective. And yeah, I have a little one in the background, so I may be pulled away at times. It's bedtime.
That's all right. All right, starting timer. Board, any questions for Kimberly, for Stephanie or Rachel? Alejandro, go ahead.
First of all, let me see. Am I muted still? No, I'm not. Okay, cool. Stephanie cheated. She brought one of my 2 favorite peoples in this world, which is little people. My favorite people are the little people and the wrinkly people. Everybody in between is okay. So cheater. Anyways, good move. My question is on outreach. What are your outreach efforts? I saw there's some in there, but have you considered expanding your outreach to local events? Like art walks and stuff like that. I mean, this is important work. I think it's very important work. Bringing my favorite people into this world in a holistic way, and the effort, what it takes to be a midwife. Yes, it's just amazing work. I just want to say, much props, and just want to know, what are your outreach efforts to spread the knowledge?
Totally. So we do, so far we've just done like farmers markets and kind of events that are more geared towards families, Cinco de Mayo in Longmont. But we're open to really anything, any events that, are happening. We even actually, like this year for our kind of fundraising event, are considering doing like a public art piece, like a mural or something. And so we're super interested in any way that we can collaborate with the community and be spreading the word about midwives and what our care looks like for folks.
Yeah, and also with that, with us being such a small organization, having the full-time staff members are the 3 midwives, and so they are doing a lot of other work, attending births, taking clients for their prenatal care, that sort of thing. And so we try to have a midwife at a lot of our events so that people can really ask questions and get that one-on-one attention from a midwife. That feels really important to us, and it's part of our mission as being in the community. And so we have a few staff members that are part-time as well that help with admin, but we try to be strategic with our resources and how many events that we can attend with all the other work that we're doing.
I think you got to put the dads to work too.
Totally.
Just saying.
So I have a question about your application, about who you serve. So I read in the application that, about 30% of your clientele is people of color and about 30% are on your sliding scale. So this funding is really meant for you know, that low income population to moderate income in Longmont. So what do you know, is the vast majority of your clientele 70% then they can afford market rate, or can you talk to me a little bit about that demographics of who you serve?
Totally. So we just recently started asking more demographic information. So we don't have all of our clients' financial information. And so if people are applying for the sliding scale, that usually means they're on Medicaid or other state services. They're either uninsured, you know, people who are undocumented, or underinsured, you know, if they have insurance that's just a really high deductible or something like that they'll never reach, and financially aren't able to pay out of pocket. Unfortunately, our services aren't covered by Medicaid. So everything that's kind of like our solution is this sliding scale, is to make sure that people in any income bracket are able to access our care. So that's kind of what that demographic looks like. And then as far as like the rest of the 70%, it could be people like right now we have somebody paying $50 a month for our care because they're like, no, I don't need the sliding scale, I can make payments. But they're going to be paying that off for years. So it kind of varies. You know, some people might not want to access it, or they have the financial resources to sort of meet that market price, like you were saying.
Okay. Go ahead, Caitlin.
Hi. I would love to hear just a little bit. I saw that you all are working with local Indigenous communities to help provide services and in a very culturally responsive way. It sounds like really trying to tap into the ancestral knowledge. How did you get involved in that, and how is that how are you helping make sure that that is centering those practices that that those communities may already have but may not be accessing?
Totally. So it started many years ago. One of our midwives is involved with danza, which is a traditional Mexica dance. And so met a lot of community through that. And one person in particular, Yoloteo Chalchiwi, she's the founder and executive director of Harvest for All First Nations. And so it was really those two coming together, and for years have kind of been offering these services like unofficially, not that like it's official now, but it's more organized now. And so using our organization, Harvest of All First Nations, and then Dryland Agroecology, which is also a place that the sauna is at, and they're growing herbs for the ceremonies. And so with these three organizations kind of coming together and community roots having a lot established, kind of like logistically, you know, like we have an accountant and we've been fundraising. And so just kind of like us hosting this program, we also just allocated one of our admin people to be like kind of the head person of that organization, organizing that program, I should say, but really led by Indigenous people. And so our organization is really taking a back seat to like any of the programmatic stuff, and really letting the Indigenous people who are training and who have been leading that take the reins.
Great. Thank you so much.
Yeah.
We have about 2 minutes left. Any other questions from the board or staff?
The name drop. I've been working with them as well a lot, so it's really great to see that that's who you brought in the fold.
Yeah.
So yeah, it'll be cool to see them or members of the community also be a part of your leadership in the future.
Absolutely. Yeah, absolutely.
I don't have any questions. Caitlin asked the question that I was going to ask. So thank you, Caitlin.
And yeah,
All right.
Oh, are we done?
I did have one comment as well. I was not aware, but I just commend you for having a Spanish only breastfeeding circle. I think I saw that you have the only one in Boulder County.
Yeah.
I know that that is something that I have heard from folks. And so it's one of those things of like, oh, I'm really glad I know that because I have heard, you know, folks asking if that
Yes,
exists.
spread the word.
Awesome. So if nobody has any questions, I'm going to stop this timer and I'm going to start the 5-minute timer for you all to share. And again, you don't have to use it all, but you have 5 minutes if you, whatever you want to share.
Yeah, I can go ahead. I think that one thing as an organization that we're really trying to cultivate is being responsive to the community. And so just being really excited as like a newer kind of smaller organization, just to be reaching out and like meeting all of you tonight and just like being able to kind of tap into what our community needs are. You know, we came in as home birth midwives with this organization, and now just seeing the different ways that we can show up, and even not even us showing up, but facilitating other people to show up for the community has been really incredible. And so I feel super grateful just for the opportunity to keep doing that.
Stephanie?
I guess what's coming to mind after Rachel said that, it just, you know, it's in our name, we're community roots. And so it feels important to build this relationship, especially within the city that we are. This is where we are. This is where our clinic is. We're serving a lot of people here, and within Boulder County as well, but a lot of mostly people from Longmont. So yeah, I just want to name that. And yeah, it's been interesting to see where the community does want us to go and really support and uphold. And that really has been, like, I feel like home birth and midwifery is a really big part of our offering, but even some other things that are really coming up for us are our low intervention family planning and IUI for folks who need that support at home, or the Sarada work and the ancestral traditional practices that we're trying to, we, as privileged people who've been in this place for a while and in these positions, we have skills and we know how to fundraise, we know how to write grants. And so that's something that I feel really called to offer to these programs and these people who are doing this really amazing work and may not have that skill. So that feels really important to me. And yeah, and any other specific programs, Rachel, that you'd want to mention? Or even some youth work. We're looking at working with youth around moon circles and having these gatherings where they learn about their cycles and really connect with the earth and the moon. So that's also coming online for us as well over the next year, and hopefully it's going to expand.
All right. Well, thank you very much for your time tonight. If the board has any questions, I will follow up with you and then get your answers to the board.
Great. Thanks.
Have a good night.
So nice to meet you all.
So real quickly, board, before you get off, just so that our new board members know, we usually have a conversation as part of our deliberations just to check in and see how these hearings went, get your feedback, ways to improve, things like that. And I appreciate you all being here tonight. We got one more night tomorrow. And again, take what you learned tonight and think about what our priorities in Longmont is. Think about how these align with those priorities, and also be aware that we have much more in ask than we have resources to give. So take that into account as well. You guys make some difficult decisions, and we really appreciate your time and the effort you have put into reading and being thoughtful with these evaluations. And we'll see you all tomorrow night. Have a good night.
I got one question.
Sure.
It's okay.
Yeah.
So the applications that are not coming forward on like this kind of platform, are they just like they feel like they don't need to come forward, or is it?
So there's been several applications that, so Christina and I do an initial review of applications. And so if they don't, if they are really off what our priorities are, or they don't fit our activities, then we have, we've talked to them and said, hey, your program doesn't fit what if they're really off, if they're questionable, we usually let them pass. But if they're like completely not what we're funding, then we will talk to them.
If they're not direct service, for example, if it clearly states in their application that it's not direct service, like it's not a program that they would be facilitating, then it doesn't meet.
Right. Or if it's just right, or like if it's just general, like we've had at least one that was only for general admin, and we don't fund general operating, we fund programs. So that's typically the ones that don't make it. But most of them, if there's a possibility, then we will let it through. But if it's really way off, we just say no, we're not going to consider it. We're not going to have the board consider it.
Okay, cool. Sounds good. Thank you.
All right. Thank you. Have a good night. We'll see you tomorrow.
See you tomorrow. Thank you. Bye.